It's Wednesday night, and we're live from Oakdale, Washington, in the Educated Touch studio. Welcome to Ethics Outside the Box, with your host, Nathan Nordstrom. Special guests include MK, Brennan, and you. Here he is, Nathan Nordstrom.
Well, hello everyone. It is time once again to have some fun with ethics for massage therapists. I'm just excited that we get this wonderful opportunity to hang out and go over different subjects and really kind of connect back to where we are and what it is that we do and why we do it. The guest that I have with me is actually one of the people that I consider my mentors, who has really shown me a lot of really important things, including policy writing, bylaws, how important documentation is, and really why all groups need to be connected with writing and knowing what they're actually supposed to be doing. It's MK Brennan, and MK, what do you got going on right now? What are you playing with and working on?
Right now, well, I'm board president for the Society for Oncology Massage, a fantastic organization who strong beliefs in education for those massage therapists who want to work in oncology settings, or really for every massage therapist, since so many cancer patients cross our doors, whether they're newly diagnosed or long time diagnosed. I've also had the pleasure of working with the Massage Therapy Foundation writing group for a number of years. And what we do is we take a research article and kind of condense it down. And those have been published in Massage Today mostly. And we're looking at other publications to put our little summaries in. And I still continue to work as in case management at my local hospital. So those are just a few of the things that I'm still doing.
So I've just been recently looking at a lot of the people who support massage therapy as a profession, and I was just looking at a couple of bios of other massage therapists and massage therapy support people, and I found it really interesting at how many nurses, psychologists, how many physical therapists, doctors of physical therapy, occupational therapists still connect to their roots of massage therapy. And I find it really fun to see that we're expanding this knowledge and really getting high-end support to massage therapy through these crossover professions. So you're also a nurse.
Yes.
And did you start out?
I first learned to give a massage in nursing school in the 70s, because it was part of nursing practice then.
And you don't see that as much anymore.
You hardly ever see it. So there's a lot of opportunities for massage therapists in those kind of settings. And that's the other thing I do. I work as a volunteer with the Academic Collaborative for Integrative Health on their clinical working group and with the hospital-based massage therapy task force.
I have several clients who are nurses, and it's always funny when they come in and they're like, oh, my shoulder's hurting. And I ask them about, so are you doing any massage at work? And they look at me like I'm just a foreign animal, of just some sort of beast that would even ask that I'm touching their patients. And I always smile at it and kind of engage them. But they realize that it's in their scope of practice. And some of them do a light kind of just barely something, but they know that touch therapy definitely has a benefit. Yes. So you're unique in a couple of ways, because you started out as a nurse, correct?
Yes.
And then you went to massage therapy.
Yes.
And so how long have you been a massage therapist?
Since 1991.
91. Okay. So you've got plenty of practice under your belt, both with massage and in the healthcare world altogether. I may be asking a couple of questions. We will definitely go back to S4OM a little bit and just kind of talk about that. But I also want to connect with this concept of continuing education, because that's what we're going to be talking about today, in other industries. And I know that you have to keep your continuing education for nursing up, correct?
Interestingly, for a number of years, there's not been a requirement for continuing education or nursing license. Now, within my job, there's an expectation, and we do have some in-house education that we are required to do every year, and then we are encouraged to do other.
All right. Well, yeah, that helps. That gives us a little bit of understanding, kind of where things are at. So let's first, I'm gonna go and start sharing right back to our good old NCBTMB website. Going to the National Certification Board of Therapeutic Massage and Body Workers website, here, ncb.org. You can type in /code-ethics. However, if you just go to the bottom of the website, you see Code of Ethics, Standard of Practice. And that's what we're going to be talking about this year. Today, we're actually talking about one of the pieces on the Code of Ethics, specifically number 6 right here, or VI, if you're not familiar with Roman numerals. Consistently maintain and improve professional knowledge and competence, striving for professional excellence through regular assessment of personal and professional strengths and weaknesses, and through continuing education training. Now, last week we actually had a short one, and this time we get one of these really long ones that has a lot of parts that really engages a lot of, I'm sorry, I'm waving my son away. So this time we're actually getting a lot of parts that are engaging, a lot of pieces that kind of really go into the importance of this specific piece. Is there any piece that stands out to you, MK?
Well, the one especially is regular assessment of personal and professional strengths and weaknesses, in that a majority of massage therapists work individually in private practice. And I'm just wondering what kind of criteria they've set for themselves to be able to really do that kind of assessment. And do they?
Oh, well, and quality assessment versus any assessment are two different things. But any assessment versus no assessment are also two different things as well. So I always hope that a massage therapist in private practice has a mentor, has someone who they connect with and collide with, and kind of gives them an idea or an interest to start moving them forward.
Right.
If they're missing that, that's going to be that first step that I kind of say, wait a second, do you even know how to go forward if you don't have a direction or a person that you're kind of in line with following up behind?
Or someone that can give them feedback. You know, one of the other pieces for assessment is oftentimes getting feedback from those that you serve. So I'm not sure that massage therapists generally are asking their clients for feedback. And, you know, where else can they get it from?
Well, yeah, and actually I've noticed several times that massage therapists notoriously have an intake interview. At least I hope they always have an intake interview. They usually have a really fairly solid intake interview, but then you start seeing the decline when it comes to an exit interview.
Right.
And even less is the follow-up interview or the follow-up phone call to say, hey, how are things going? Let's check in and see where things are at for you.
Well, and is that really a part of massage therapy education, to have that assessment piece, you know, and that follow-up or that client feedback coming to you, part of your education in your business practice?
Yes. I mean, should it be? And I haven't actually noticed if it is. It's been a long time since I went through the standards for education that were put together, but there is a communication aspect that is generalized and stated. Just you're right, not specifically stated as for follow-up, for connection, for the importance, and for that connection that you're right, you can't get anywhere else except for that person who is on the table.
Right.
I've had too many clients who have come to me saying, I wouldn't go back to the person that I just came from, because when I say, gosh, if that person would just be able to learn this aspect, they may be a great massage therapist.
Right.
Or it gives them an opportunity to improve.
Yeah. Yeah.
So, Yeah, I really appreciate that aspect. Improve professional knowledge and competencies. We're looking at two different pieces here. In my mind, knowledge is one thing and competencies are another.
Yes.
What is competencies in your mind?
Competencies really, to me, would be kind of a checklist. Can they do this? Can they do that? In my nursing profession, we have to have this test of competencies every year. And you have to be able to do these certain specific things. When we worked on the hospital-based massage therapy competencies, we looked at what are the baseline things that someone needs to be able to do or know to work in a hospital setting.
Yeah.
And it should be where you could set up a checklist and say, yes, on evaluation, this person has met this competency.
See, and I usually think of competencies as a practical aspect, being able to demonstrate a skill
Yes.
as a physical concept. There are mental competencies as well, where you can run through certain hoops mentally. You can go through and you can do a certain problem, or you can go through these concepts. But in my mind, especially in massage therapy, competencies more go into the actual practice.
Yes, I would
Okay.
agree with you on that. So in the world of, I work in case management in my nursing practice. I'm the manager of the department, so I get to go through all these with my team. And yes, it is, are they able to do ... And it's to do. With the hospital-based massage therapy competencies, part of those are also your communication skills. And that is also a to-do, but it's not so much the same kind of action.
See,
Similar.
I love that, especially communication competencies change with every person who walks in, because no two people really communicate exactly the same.
Right.
And so can you meet these standards of getting this information that makes it safe for you to work with that person?
Mm-hmm.
That's kind of the overarching concept. And then I've seen on practical exams where instructors, who are mean and cruel, because we all are, will toss out a person and they'll say, okay, your job is to not give them this information. And then the student comes in and says, okay, so what's going on today? Oh, I feel fine. Okay, do you have any diagnosis that, well, not that I'm going to talk to about. Okay, and they make it more and more difficult. Now, most of the time, your clients aren't going to be that difficult, but sometimes they can be.
Yeah, and part of that is the skill of the therapist then to be able to draw out the answers that they need to be able to, go forward with the session. And that can be challenging.
And part of it comes with the gift of gab. I mean, if you've got a skill where you can appropriately connect with a person and smile and really have them kind of build a instant rapport with you, gosh, you're going to have it so much easier than a person who has slight challenge communicating and asking hard questions.
So one of the things that we have within the hospital is, kind of an acronym for, how to relate with people or greet people or communicate with them, I should say. And one of the pieces of the acronym is relate. So even before you're talking about, the session or anything, if the person comes in with, the jersey of their favorite team, relate with them about, I see you're a Pats fan. I'm so sorry about the Super Bowl. But relate with them on a level other than what they're there for. The other piece is for communication. Fortunately, we were able to go through a training session on motivational interviewing.
Nice.
And it might be beneficial for massage therapists to look up motivational interviewing and see if there's a session near them, because it's It's how to have a discussion with someone where you're not just getting yes or no or I don't know answers.
Oh, beautiful. Beautiful. Yeah, open-ended questions to really engage. I love that. That is something that I think a lot of massage therapists could really learn from. So the other competencies that I like to really kind of connect for massage therapists are the body mechanics competencies. When we're looking at, is that massage therapist going to be safe in practice for 5 years, 10 years, 15 years, 20 years, their whole life? It's important to come back to, what am I doing today to meet a competency to make sure that I'm not causing extra strain on my back. I'm guilty of this once in a while, where I've got a client with a big, huge 7-foot guy, and I'm trying to do a stretch for their hamstrings, and I'm trying to use this big, huge, giant leg and trying to get it over the place. And I really feel guilty for that 4'9", 5-foot massage therapist who's trying to work on everyone. And I go, oh, this is what it's like to be them. And so what do I need to do to learn from the shorter stature therapists so that I'm not injuring myself?
Right.
I had a student when I was in Savannah who, she was a short little bit of nothing. And she was just the sweetest girl, but she would watch me do these stretching exercises and she'd say, Mr. Nordstrom, I can't do that. And I said, you can't do it the way that I do it.
Right.
But you can do it with assistance, support, and with the right direction. So you have to work through those pieces, but those are the pieces that are going to be important. She's like, well, okay. By the end of the 9-month program, she was doing it better than most of the regular students, the larger students, because she was consciously engaged. She was mentally there. She had to really kind of prep, not only with what muscles am I stretching and why, or what am I elongating, what am I shortening, but then she also had, okay, so what other muscles can fire to really support me in making sure that I can do this? It was a lesson for me to kind of go, you know what, she's gone through her competencies to say, I need to get to this point. What steps do I have to take to get there? It was really insightful to me.
That's where critical thinking comes into play, and having a strong knowledge base, and knowing that things are not cookie cutter, because everybody that comes to you for a massage session is different. From, in my 27 years, it goes from that 300-pound football player who's all muscle to, the person who's like maybe 100 pounds soaking wet, who's a long distance runner.
Yep.
And very different people are going to show up for you.
Yes, they are. So the next one that I really am excited about is striving for professional excellence. That's this little tiny statement that I think kind of weeds out what a quality massage therapist is from a person who's rubbing people.
So I'm wondering how the profession would define excellence.
Yeah. Well, do we have an excellent statement?
No, and we don't have a lot of the pieces that are a part of this standard, this code. I don't think. We don't have set competencies for an entry-level massage therapist, except defined necessarily by each school.
Well, by each school, that's definitely one. But then also, if we say, okay, if we're looking for competencies, you have the school, you also then have the continuing education group or society or whatever group where they're saying, you know what, this is what it takes to be competent in this special modality. This is what it means to be excellent.
Yes.
we can disagree.
I would agree, only in that I competencies are not set generally the way that I view competencies. So again, and I'm not sure, who is defining this excellence, and
who is demonstrating it.
Yeah. And I will tell you, in my 27 years of practice and the years before where I first learned massage, limited massage, I will grant that, I'm not sure I ever felt like I attained excellence. There's always something more to learn, and the more I learned, the more I felt I didn't know much.
So that's where that first word comes in, and it's striving for.
Mm-hmm.
Because, I mean, just like we've talked in the past about what are you following or who are you following, having that mentor to a beginner, someone who's been in practice for 5 years, is so much more advanced than them, and so that's what they're striving for. But by the time they get to 5 years, hopefully that person who they're following has also their mentor at 10 years should be demonstrating a greater knowledge, greater expectation, greater understanding. That's why it's important to choose your mentors wisely.
And that goes into the whole other part of this, is the continuing education. So is that mentor continuing their education, or are they stuck in what they were taught initially, or maybe through the first 5 years? Because I'll tell you, what I was taught back in '91 is nowhere near where massage therapy education is today.
Absolutely. It's not the same animal.
Not at all. So, you know, it's built upon what I learned in '91, and for those before me, you know, it just keeps building. It's certainly built on from what was taught in the turn of the last century, when massage was, you know, a bit more around, or as around.
Well, and I remember when I was in massage school, we were taught in massage school that any person who has cancer, you just can't touch, period.
Cool.
That's it.
That's what
done.
was taught.
And I being a slight bit of an instigator,
Slight?
okay, a bit, I told them that doesn't make sense, because there's a huge population that you're saying we can't touch and give benefit to.
Mm-hmm.
I said, it may be that we need to have more education. We need to know more about a pathology, but I'd say that's true about any pathology.
True.
If you don't know what's going on with arthritis, you probably shouldn't be working on a person with arthritis.
Right.
And so if you're looking at cancer and the many varieties thereof, gosh, that's going to be a large conversation, a large discussion, and I don't think a 6 or 8 hour class is going to really prepare you successfully to say that you can work on on any cancer patient, or basic oncology massage,
Or a cancer survivor.
Or a cancer survivor.
One has to take into consideration even 20 years out of a cancer diagnosis.
So what is the, if I may ask, when we're looking at oncology-based massage as continuing education, what is the time frame for when they're a cancer patient or victim, or however they want to stabilize that, to a survivor, to someone who once had cancer in their life history? Is there anything of that nature?
I'm kind of lost you in the beginning of that question.
Okay, so there's different times in a person's life. So someone before they have cancer,
before the diagnosis?
Before a diagnosis, they don't know anything. They're going through and experiencing standard life. Then they get the diagnosis, and now they're a cancer patient.
Right. And then they're a survivor.
They're relapse possibilities, and then they're out of.
Or they're long-term survivor.
And so you're a long-term survivor for the rest of your days, correct?
Yes.
So.
And there are certain risks that you may have, you know, depending on what cancer you had, what treatment you had, all of that. So massage is safe and effective at any points along that continuum, as long as you've been trained on how to safely and effectively deliver the massage, so that you're not going to contribute to like the side effects that can happen with a cancer diagnosis or treatment.
So this is where I say continuing education just amazes me, because a person who generally comes out of massage school, by category, has been told that they are ready to touch the standard healthy person.
Yes.
And that's kind of where they kind of say, okay, so this is what I can do. Now, there are some programs that do specialty in their program where they touch on oncology and they have a more intense pathology class where there's a practical and a tactile understanding there. But most of them are just trained to deal with healthy people. So continuing education, sorry about this, I'm going to have to...
Cough. Go for it.
All right, there we go. So for continuing education, we start looking at these different varieties, and I see multiple different connections to continuing education. First one is the pathology-based continuing education. Second one is technique-based continuing education, where they're looking at something specific. And the third one just left my brain. Pathology, technique, and research.
Or theory.
Yeah, theory, kind of concepts that are out there.
Right.
And when you kind of break those down, they're all going to give you different things. I know at most conferences, the hands-on classes are the first ones to fill.
Right.
Well,
and I think a lot of those are perhaps some of the newer massage therapists.
Correct.
Well.
Correct. And I guess by the time you go through enough hands-on classes to realize that there's nothing really new in how people touch, because it's skin to skin no matter how, and there's little tweaks and little things.
And adaptations. Yeah.
Yeah, all different adaptations with different names and that kind of stuff, but it's all pretty similar. You start wanting more, and you start wanting to figure out what the new piece on theory is, or the new research, or really, wait a second, I've worked on a whole heap load of people who have this condition, and I don't quite feel like I fully understand it. I want to go figure out what to do with a person with rheumatoid arthritis or osteoarthritis, or and those classes are starting to really show excitement and starting to get a really good following, including with different pathologies.
Well, and I think that's important for people to realize that, because the people that are showing up on your table oftentimes will have had an oncology diagnosis. They may have diabetes, they may have CHF, they may have COPD, they may have arthritis, as you said. They may have had some surgeries, they may have had some fractures that you have to pay attention to. They may have, and these days, a lot of people are getting knee and hip replacements. So, you know, there's a slew of medical conditions that we as massage therapists need to have some knowledge of. The same with, and this is an area that I'm hoping to develop further, and I think there's some classes being developed in this a bit more, is pharmacology for massage therapists. To have an understanding of, you need to know what these medications are, what the side effects are, just as a nurse does. What is the patient taking them for? Because if you have on your intake form, you know, what medications are you on, and you don't know what they are, you don't know what lisinopril is for, well, then you're not going to be able to ask that next question about, and how's your blood pressure being maintained? You know, have you had any tingling of your lips, you know, which would indicate, you know, the start of some sort of reaction to the medication? Those kinds of things.
I love that concept, because I know when I was in clinic, a clinic supervisor, one thing that I had well, I had several copies of it, but was the Pharmacology for Massage Therapy book. And it's really well done. It's definitely the lightweight version of Pharmacology for Massage Therapists. But it's one of those books when a client would come into the clinic and the student would go through their intake interview, I'd say, okay, so what medications are they on? And they're like, oh, they've got this list of 5. And I'm like, you know where the book is, go look them up.
Yeah.
And it only takes really them looking up a couple of those medications once, maybe twice, for them to go, okay, I know what this one is.
Yeah.
And I wanted them, before they got into practice, to be able to say, I know what those medications are, or I can definitely work with figuring out where they are. And being able to have a good reference material is always worthwhile.
Yeah, and I'm not, I'm not saying that massage therapists need to have the extensive knowledge that those in the allopathic medical world have. You know, what the knowledge I have to have as a nurse is different than what I would expect a massage therapist to have. However, because nurses generally are dealing with people that are sick, you are dealing with relatively healthy people who may have some sort of diagnosis, who may be on some medication. You need to have a familiarity with those,
Yep.
not necessarily a deep knowledge of them.
Well, and I've used several times the questioning method of a person who's taking a medication should be a basic expert of why they're taking those medications.
Right.
And that always has helped me be and open up that intake interview and that really discussion piece and say, wait a second, why are you taking this? Okay, well, it's an anti-seizure medication, but you're taking it for what? Oh, depression? Huh. And that makes me then want to look into it and see if in it says anti-seizure medication and for depression.
Right.
And you can go, oh, got it. I understand.
Well, and then you don't have to worry. You don't have to be asking, and are your seizures? What was the last one you had? Yeah.
Yeah, I've got my son who's epileptic. Has taken several over the years, and I've seen several other people taking them. Like, really? And they're like, oh no, I'm taking a real low dose for this. I'm like, oh, okay.
Yeah.
That makes sense.
I would say the other, well, in terms of education and some of these diagnoses, you know, diabetics, we're seeing such a rise in diabetics. And one needs to, I think, have an understanding of that as well. It's whatever, if you're working in any kind of an environment, you're going to see patients with, or clients with these kind of conditions at one point or another. Oh, you're on mute, I believe. I see your mouth moving.
I muted for a cough and I didn't unmute it. Darn it. All right. Yeah. So I think all of that, especially with continuing education, really draws back to one other aspect, just a couple of words before it, and that is personal and professional strengths. And really being able to assess your personal and professional strengths.
Right.
I think for me, your professional strengths are kind of a go-to. You're like, okay, yeah, I'm trying to get better as a professional. However, are you personally improving yourself and strengthening yourself in the things that you can do, in who you are? It's something that I don't think gets addressed as much for a massage therapist. However, I do know when we start looking at your licensure, states are going to be expecting that you haven't received a felony over the last few years. You haven't fallen down into an addiction condition. You haven't. They want to make sure that you're maintaining your personal best so that you can be professionally best. And I don't. It's hard to talk about that in the massage therapy realm, but really as a massage therapist, you're expecting your clients to be coming in and trying to improve themselves.
Mm-hmm.
And so are you doing the same thing and showing a good example?
Well, it goes into that whole self-care piece. And how much do massage therapists, where is that work-life balance? You know, I've seen massage therapists, some work, you know, see up to 10 clients in a day. Well, you know, what kind of service, you know, is that to themselves? So again, there's that. We did, you know, talked earlier about how are those things assessed, you know, and is someone doing a self-reflection for their own personal growth, for their own personal expectations, for their own personal way of being as a massage therapist.
That kind of makes me laugh because in the last office that I was just at, I had a really unique schedule, and all the rest of the massage therapists would just cross their eyes and go, oh, Nathan, how do you do it? And I would have 4 clients on Monday. I'd have 8 clients on Tuesday. I'd have no clients on Wednesday. I'd have 8 clients on Thursday, and I'd have 3 clients on Friday. Those 2 8-hour days were definitely my long days. They were definitely more challenging, but I justified that in a couple of things. I had a hour and a half lunch in the middle, so I just called it two 4-hour days back to back. And so I had a time to rest and recharge and eat and that kind of stuff. But the other piece that I found very beneficial is that I could work into the evening when my clients wanted to see me.
Right.
I could work in the morning when I had people, diehards, who really needed to come in. But I also then had a half day on Monday, a half day on Friday, and a free day on Wednesday to do all my paperwork. And so I got my batteries recharged through the rest of the days. Now, is that a good schedule for everyone? Definitely not. I know several people who, actually, I was the only one who would do that schedule in my office.
Well, and I'm thinking Friday mornings and Monday afternoons would make for a good long weekend too. So not so bad for that.
Yeah. So I can add to the long weekend, and I got all of my paperwork done in the middle of the week where I was doing a lot of other stuff. So it really worked well for me, but that doesn't mean it works well for everyone. And so I think part of that personal strengths is knowing your body, knowing what you can and cannot do. Because exhaustion hits everyone at a little different state.
Right.
And there's the physical exhaustion, but there's also then the mental exhaustion.
And the emotional.
And the emotional exhaustion. Absolutely. I've been at board meetings and conferences where my physical exhaustion was still pretty low, but my mental exhaustion was through the roof because they were talking about subjects that just worked to the peak of my brain cells. And I was just trying to pull up data that had been gone for 5 years in my brain. So it's important to kind of connect with those pieces as well to say, hey, you know what? We want to stay successful, we want to stay professional, and we really want to see those strengths go into what it is that makes a quality therapist.
Well, and I think that's all of what this standard speaks to, is being your very best.
Yeah.
You know, how do you rise up as a massage therapist? One would be through your continuing education. One would be through your assessment of yourself and your professional, aptitudes. One would be through being able to have that competency and have a knowledge base. So I think this one in particular really speaks to wanting a massage therapist to grow as a person, as a massage therapist, and for the massage therapy profession.
So I look at this, because this is from the National Certification Board, they're trying to make sure that there's a quality stamp of approval that says, yes, this person is doing these things.
Right.
However, I find it slightly different from what the state licensing boards are doing, even though they're also requiring continuing education.
Right.
Most state licensing boards are striving to make sure that you're safe to the public. That's kind of their overarching responsibility.
That is the responsibility.
And so that continuing education aspect for meeting your state licensure is only at one level to say, hey, are you making sure that you're keeping yourself safe? Where I think the National Certification Board kind of goes a different direction, and they're saying, hey, you know what, we want to make sure that you've got a quality here. And in that quality, they even respect and expect you to take continuing education from board-certified continuing education providers.
Right.
And so I'm licensed in several states, but Oregon is one of them. And several years ago, there was a change in the expectation for the Oregon Board, from the Oregon Board of Massage Therapy. When I was new in the profession, if you had 3 massage therapists get together and talk about massage therapy in any aspect, the person who led the conversation got 2 hours for every hour, and the other 2 got 1 hour for every hour that they sat down and were talking. It was baffling to me.
It sounds baffling.
It was such a low standard to say. I think they were just trying to get mentoring concepts, just to say, hey, if you can sit down with other people and talk, then at least that's something.
Right.
And then the state started saying a little bit different of, oh, hold on, let's refine this category of what you can talk about. Let's talk about ethics. Let's make sure that you have ethics classes. And then several of the states, and most of the states, do have a standard requirement of you have to get CEs from someone who is a teacher or NCB approved. And now a lot of states are actually going a different direction and adding on, hey, yes, and we need to approve the CE class that you're taking. And so I've been spending a lot of time with paperwork now, applying to Idaho or Florida, or and getting all those ducks in a row as a CE provider. I don't have a problem with that. I'm excited about that. I'm glad to see that someone is holding them to a standard.
Well, there's one of the evolvements in the profession, and that Florida required that all along. You had to be approved by Florida, and New York State as well. You had to be approved in New York State to be a provider.
And interestingly, NCB now has a fast pass to becoming an approved provider of CE. However, you still have to go through the New York State approved provider paperwork, and I love that. I have not yet done it. I was laughing because I looked back at some of the paperwork that I had for NCB, and I initially started the application for New York in 2014. And I went, I should get that finished.
It's 2018.
I know. It's been 4 years just sitting on my desk, and I kind of went, yeah, I'm going to get to that eventually and get out to New York and start teaching out there. But I don't know if that's going to happen. But it's one of those things that, for me, when I'm looking at my professional competencies and my skills, and it's something on my to-do list. And I think having a to-do list and a to-done list are two pieces that help a person recognize if they're striving to improve, if they're aiming for that next step, and then if they have met that next step. Because the to-done list, first of all, to me, feels like such a reward. When my wife puts on the board, hey, could you go get this and go do that and do this, I always am a little saddened when she just erases it. Because to me, I have to write a line through it.
Oh,
it's done. It's done. It's
honey
done.
Done, not honey do.
And then she's like, okay, now I can erase it. And
she just, Elena's just going to add more for you. So
don't worry
about that.
Oh, don't worry. It loads right up to the top again and comes on down. So
I will tell you, one of the things, Nate, when I read through this standard, one of the things that struck me is especially the continuing ed part, because I remember back when we were working for licensure in North Carolina, and we had a continuing ed requirement in there. I heard from people, because I was working towards that licensure, why should I have to go for continuing ed? I've been doing this for 20 years. In particular, I had one from a nurse saying, I've been a nurse, I've been a massage therapist for, so many years. Why should I have to do continuing ed? And they didn't see the value in ongoing education, which made me sad.
Well, and I've always considered myself an eternal student. There's always going to be something new to learn. And I get a lot of one of my favorite classes to teach is Fully Exposed Ethical Dilemmas. It's an ethics class. We get people in the same room, and we really talk about stories and get people connected and thinking a little different than just their own personal experience. However, the number of massage therapists that I've had in that class who have had 20, 30, 40 years experience come in and say, I don't need this. I've taken every ethics class there is, and you're not going to surprise me.
Why is this required of me again?
Why do I have to sit here for this time? And my answer, maybe a little flippant, but I know, me flippant, is, well, obviously you didn't learn it the first time. And then they kind of look at me like, what are you talking? And I'm like, well, yes, we all have new experiences. We all have new life. We all have new things that are going to be happening to us. And so one of the best things we can do is revisit some of those things that are going to make us better.
Right.
And so the flippant aspect really comes back to that education. But I don't think I'll ever know everything. And I also don't think that when I'm saying I'm not going to learn everything, that doesn't mean I don't have to learn everything. That everything I can, that means that I'm going to be constantly trying. That also means I'll be failing and relearning some stuff, because that's kind of the best tool there.
Well, the other part is we've seen a growth in research in massage therapy. I know in my 27 years, I knew I would get you on that one.
Oh, it's so good.
27 years, back when I started, you could put the amount of research in a thimble. And then, Tiffany Fields with the Touch Research Institute, oh my word, through the 90s, I was, devouring stuff that she was doing. And we've had so many more since then. I still am contacted about the study I did that was published in 2003, for heaven's sakes. So it is ever evolving and it's growing. And that happens, I think, I'm sure, in every profession. So why would massage therapists not think that they need continuing education? Because there's new research showing this. We have that in my nursing practice. We have it in medicine. Being evidence-based, and I hate saying evidence-based, evidence-informed to me is much better, only in that chances are next year there may be another study that kind of changes what came out now. We all heard about, frying a hamburger in a frying pan is carcinogenic. Well, okay, and then it changed, and then something else changed. So this is your lead-in for that research piece.
Well, and it's funny because I got to jump back for a second because I love the concept of evidence-based versus as evidence-informed. I always think of something as two-dimensional, like a paper or a class is evidence-based. But if you're alive, if you have a pulse, you're evidence-informed. And so I'm trying to constantly be informed, and something that is stagnant and doesn't have development is just it was based on the evidence at the time. And it's dated, and it says, here's the evidence that was available
at the time.
At the time.
I have a Grey's Anatomy from the late 1800s.
Awesome.
Because my great-grandfather would have been studying that book. He was a surgeon at the
wow.
century. And I go through it every once in a while, and I'm like, wow, look where we've come in all those years. So, yes, evidence-based for that time.
I also love going through and finding those small muscles that massage therapists never learn in massage school. One of my favorites that I toss out there is pyramidialis. And everyone kind of goes, I don't know what pyramidialis is. Well, that's the base of the top of the pubic bone going to the rectus abdominis. It's a little muscle that stabilizes there.
See, I've learned something new today.
See, I mean, if I can do that for you, that's great. But that's those little pieces where you kind of say, okay, we have more to learn as massage therapists, even in the things that we're interested in. And thank you for leading into research, because I simply pulled up PubMed, PubMed.gov. If you just Google search that, PubMed will come up. And the only reason I really wanted to point this out is if you say, okay, I just want to look up massage therapy, just those two words, and it's going to have all sorts of different pieces, obviously, things that aren't exactly related. But if you come down to search results, items, this is a 20-page or 20 document list. So 1 to 20 of 13,746 currently in PubMed. That is not all the research on massage therapy. That is just what is put into the public medical archives for the U.S. National Library of Medicine and Institution of Health. So that is right there is a direct tool for you to start using to say, wait a second, let's look up massage therapy and whatever pathology you're currently working on or concern that you have. I always find it funny because I am a strict believer in the concept that when you have someone come in with a pathology.
You there, Nate?
Oh, I am. Are you there? Oh, she's coming back on.
I'm here.
Okay. When you have someone come in with a pathology, statistically in my mind, and I don't know if this is true, but it just seems like someone else is going to come in with that pathology.
Mm-hmm.
And I usually get like 5 people with the same thing. And so it's always fun when I see someone with something new to go, I need to look this up. The universe or whatever else is telling me, God, anything is saying, you know what, you need to look this up because someone else is going to be coming in with it. And so looking it up and getting that research and getting that background so helps me.
But Nate, the other piece of this is knowing how to read the research. So knowing how to look at the N number. Is it a study of 20 or is it a study of 200 subjects? What was the research question? What was the application that was used? What are the limitations of the study? And what really are the conclusions? Is further study needed?
There's always further study needed. We all know that.
Always further study needed, yes. But being able to read research so that you're not jumping to conclusions that are not necessarily true is an important piece.
Well, and I love that goes into that continuing education because I know the Massage Therapy Foundation has had research literacy class that they've put out, and there's a lot of researchers that put out research literacy classes. And there's even outside of the massage therapy industry, you can do classes, you can do webinars about research literacy and get a lot of understanding specifically on what is the p-value and what are those reasons for actually knowing that. And
not have to worry about knowing if you know statistically significant or an ANOVA. Any of those other things that those of us that have done research, know. And again, the Massage Therapy Foundation is a great resource, and there's Research Perch. There are those articles that, the writing group has printed in Massage Today. And, as I said, we're looking for other places because we condense it down and try and have it where you can read it quickly. Massage Therapy Foundation is also starting with infographics.
Yes.
So the writing group, I'm involved in that with the infographics, which should be a quick, easy reference for massage therapists to have on certain subjects.
A couple of weeks ago, I had Ruth Warner with me, and that was one that, first of all, Ruth and I always banter really well back and forth, but I was really intrigued because before she started, I wanted to talk about the research Perch. And we got all the way to the end, and I completely forgot. And then we got off, and I went, "Oh, wait a sec, the research Perch! Oh, dang it!" So
glad I could bring it up.
Yeah. So let's wrap it around 2 weeks late. And when we're talking about continuing education, that's one thing. But when we're talking about bettering yourself and understanding your profession, which is the rest of this whole concept, that's so important to really kind of grab a hold. And if you just have an hour and you say, "Hey, you know what? I want to know more," just grab one of those research Perch. I mean, it's a quick webinar just similar to this, and they have fun, they engage, and they talk about specific aspects of new research that's out there. I can't say anything more other than how much fun it can be if you're really looking for it.
I'm trying to think on Facebook. I know I've seen, links for Research Perch. I've seen links for the Massage Today synopsis that we do with the writing group for different things. We try and do an article a month. So,
Nice.
There's a wealth of information there.
Absolutely. There's one word that I really wanted to address that is in the second half, and it's talking about assessment of personal and professional strengths and weaknesses. The weaknesses, I think, are almost harder for people to see. And it's harder to connect with, and it's harder to accept those weaknesses for so many massage therapists. But I think you're stronger and safer as a massage therapist if you look at those weaknesses and when someone says, hey, you did this wrong, instead of justifying, well, I did it okay because this is how I knew it, reflecting and saying, is there a way that you think I could do better? And recognize that we don't know it all, and we are constantly growing, that we do have weaknesses, we have limitations. I have to say, for me, energetic work is not my strongest skill. And I know it works, and I know it helps people. And so I know who to refer out to. I know the massage therapist in the area who I can say, you know what I'm doing isn't giving you the results that I'm expecting. Would you feel comfortable going to another massage therapist who does lighter work?
Right.
And knowing my weakness.
I think that comes from starting from a place of humility as well. So, if you start there with yourself, this is part of that, assessment of your personal, as you said, strengths and weaknesses, but you start from a place of humility. And what can I learn more about? Where is it that I'm feeling that, maybe and that goes into that mentorship or connecting with other massage therapists. That's one of the things. Back when I started, AMTA was the only game in town, and thank heavens, because I had right away, I got, I was within this chapter and I got involved, and there were other massage therapists that I could connect with on an immediate basis.
Yep.
And found out how much I didn't know, and continued to find out how much I didn't know through the 27 years of my practice. So I think you start from a place of humility and just be looking for those opportunities.
Yeah, and being humble as a massage therapist makes you a much better massage therapist, makes you a much better human, and makes people want to hang out with you more.
And you might not feel it so much when that client gets off that table and says, oh, I feel so much better. You took care of my headache. And, you're yeah. I say, don't break your arm patting yourself on the back. But
it does.
I will tell you too, and a lot of people I know in the massage world probably already know that, I broke my leg in July. And I got to tell you, that was really a true learning experience, because I had to work, I worked with physical therapists as the patient. And it was a whole new world for me. And sitting there thinking about what muscles with the break, seeing the x-ray, what muscles were impacted, what tendons, which ligaments, why am I feeling a pain here? Oh yes, it must be because of that. And working with the physical therapist. I mean, it was amazing, the lessons I learned.
Well, and I love the statement, physician, heal thyself. We can't massage ourselves as massage therapists effectively, but yet we then get nitpicky about how other massage therapists massage us.
Yeah, I kept wishing that I could have my own massage.
Well, and so we have this snobbery that happens. I mean, my wife tells me I'm a massage snob, and I agree with her. I kind of am. I like certain things, and I think this is better than that. And when I get on a massage table, the first thing I have to do is check myself and say, you know what? It may not be what I would give, but how much better will I feel, and will it be for me because I stopped, turned off my brain, allowed my own consciousness to be free and relaxed? That's going to be more beneficial.
To move into the client realm rather than the therapist realm.
Exactly.
I don't know if others watched, I think it was Chicago Med last night, but there was a surgeon who needed to have surgery. And he requested to only have an epidural so that he could be awake during the surgery. And so then during the surgery, he was directing the surgeon what to do as though he was the surgeon. So it's that kind of thing where, no, you now are just the client. You are now just the patient having surgery done. You let the other experts take over.
Exactly. And you have to trust the other experts. So with that all being said, MK, I need to thank you because we're wrapped up for the hour, and I really do appreciate the time that you've spent with me. I have learned so much from you over the years, and today you've been an inspiration and a real joy to work with in so many aspects. So,
well, thank you, Nathan.
Thank you.
Always a joy to speak with you.
All right. And so I need to do a couple of things here. This is what I always crop out of the process here. Let's go to share screen here. Video, hit that, and hit that, and close that up. And I think I am ready to move that out of the way so I can hit.
It was nice to meet you, MK Brennan. Thank you, Nathan. The hour has flown by. We hope you've enjoyed this discussion with Ethics Outside the Box. As you've seen, Nathan uses many second-hand stories of ethical situations. If you'd like to share your story or you have any questions, feel free to contact him and Nathan at educatedtouch.com. If you'd like to register for next week's live webinar, go to shop.educatedtouch.com. Under live webinars, you will see all upcoming webinars. If you have just watched this video and would like continuing education for home study, you can go to shop.educatedtouch.com under the home study options with the date or episode number to receive your exam. If you would please like this video and subscribe to our YouTube channel, we will keep you up to date on new videos. If you'd like to attend one of our live courses, you can find upcoming scheduled events at www.educatedtouch.com. Thank you for joining us today. Be well and have an ethical day.